Start with a patient example. I have a patient who's actually a physician and has been getting literally 10 to 11 hours of sleep per night and still doesn't feel rested, still feels tremendous drag on her job performance. And so, I mean, obviously this is a great example because it's so simple. When it's that extreme, you know you need help. But it can happen at much less obvious levels as well. So in her case, for example, she got a sleep study. Now, let's talk for a minute about what a sleep study is. A sleep study is where you go and spend the night in a lab where they're measuring your brain waves during the time that you're asleep. And from that, we can learn a great deal about the different stages of sleep that you're experiencing. Basically, if you think about it, good sleep is like a ballet or some kind of choreographed or orchestrated movement. There are different stages that should segue into one another, and a pattern should emerge, and the pattern should change from sleep cycle to sleep cycle, and it's really a beautiful thing. But it also leaves lots of room for disruption. And the ways in which the sleep architecture, as we call it, is disrupted can give us clues about what kind of problems people are experiencing. So in my world as a psychiatrist, you can imagine, I mean, let me just ask you, especially if you're dealing with kids, because it's more easy to comment on them versus a spouse, if someone hasn't slept well, what is their mood like? Are they easy to be around? Are they pleasant? And, we can be honest ourselves. I'm more irritable if I haven't had a good night's sleep. So now imagine over time if you have a condition that actually synergizes in a negative way with poor sleep. So for example, depression, anxiety. Together, depression and anxiety affect over 25% of people lifetime. So this is a very common thing. Now, when you are depressed or suffering from anxiety, and I don't mean just one day, but actual disorder, long periods of time, 2 weeks or more, you actually have characteristic changes in your sleep architecture that worsen the quality of your sleep. So on top of having these unpleasant emotions, your sleep is also disrupted in a way that perpetuates the unpleasant emotions. So it's very difficult to catch up. And so these are just a few examples of a just hugely underexplored field. I mean, sometimes, just to make a point, I tell people that in my field, almost every single disorder can be expressed purely from the standpoint of how sleep is disrupted. And I think other doctors can do the same, because every patient, no matter what, has to spend a big chunk of their time sleeping, and inevitably we find problems in that corresponding to the type of illness that they have.